Good morning, everybody. Welcome to another of QRA Live with me, your host, Jimmy Yen, aka the Acu Sensei. Let me get the chat going and we'll get right in. We'll get started. Get the chat. Awesome. Got the chat going. So for those of y'all who are not subscribed to our channel, please hit the subscribe button so you know every time we go live. And QRA Live, I need to give a disclaimer first, otherwise Google will take me down. I am not a physician. I was not trained to prescribe medication, to do surgery. Anything that I share with you today, it is only my experience, my team's experience. It is not medical advice for you to do by yourself. Whether I believe in that disclaimer, that's a whole nother story. We won't get into it. But the purpose of QRA Live, for those of y'all who are new and you do not know what QRA Live is, first, welcome if it's your first time. If it is your first time, please type into the chat where you are logging in from. Where are you tuning in from? Type into the chat. I've got the chat, live chat open, and I will respond once I see your comments. QRA Live is QRA, first of all, stands for Quick Restorative Acupressure. It is not acupressure. It is different from acupressure. Acupressure is what, as a licensed acupuncturist, and when we were taught in school, we were taught acupuncture points. Those, when you apply pressure, instead of putting a needle, an acupuncture pin, though that is acupressure. And acupressure is like, hey, you have high blood pressure. You're going to press this point, large intestine 14, and this will help with high blood pressure. That is acupressure. What is QRA? QRA, quick restorative acupressure, something I invented, does not use points. There's no points because there's a trillion points. Any point in your body, any part of your body can be a point. So acupressure is you put this point, large intestine 14, and that is for hypertension. What would I do for hypertension? Well, if it's related to if the root cause is a heart dysfunction, I would use this whole arm as for hypertension, for high blood pressure. I would use this whole arm, not just this point. See, in acupressure, you would only use one point. But what if the point, why do I not use acupressure? What if the point doesn't work? Then what? Then what do you do? As a acupuncturist, what would I do if this point doesn't work, right? A lot of times I would go through all the points. This is when I first started off practicing. I would go through all, let's say, the 10 points. What if all 10 points don't work for hypertension, for high blood pressure? What if they don't work? Those are what I learned in school. What if they don't work? Then what do I do? I'm out of luck then. That's why, number one, these points, my personal experience is they only produce 50% results, which are not good enough results for the patients that come to see me, right? So I had to invent something different, and I had to do something different that didn't rely on points. Things that rely on points, my experience, I'm only saying my experience. I'm not saying for acupuncture, for everybody else. My experience was the results were slower and not as high. And for me, for me, it was just unethical to do that. I needed to find, acupuncture has 3,000 years of history. There's got to be a faster way, right? And so I studied with the best masters, acupuncture masters that I knew. And from all of these acupuncture masters, I created my QRA, quick restorative acupressure, right? So quick restorative acupuncture, where I put a needle in, would get 80 to 90% results for all my patients. And so that is, instead of putting a needle, you would use your finger, or you can use an object. You can use an object to push on it if your fingers are too weak, right? So since I'm talking about hypertension, instead of just this point, I would locate where's my heart if the root cause is the heart. High blood pressure, the root cause is not always the heart, okay? And actually, a lot of the times is not the heart, right? It's the liver or the kidney, right? But let's just say it's the heart. So the heart is typically the midpoint of your body to the left a little, just a little. Some people's right and center. Everybody's different, okay? But it's a little to the left, so it's about here, but it's this level right here. See under my little t-shirt, it's about this level right here. So if I draw a line to here all the way to this arm, then my arm, it's this part of the arm. See, this part of the arm has probably 100 points here that I could do that can be used to help improve the blood circulation back to the heart, improve the heart function to help regulate the blood pressure, right? So what I would do is I would go in and I would dig in to find the most tender spots all around the arm, right? All around the arm, even inside here. I would dig in to see if it was tender. And if it was tender, I would push it, right? So you can go a little up and down. It doesn't have to be just right this level or my suntan is, farmer's tan is. It could be all up and down a little, up and down a little, right? Up and down, because your heart is about this big, right? So it can go up and down. You see how it's not a specific point? That's why it's not acupressure, right? It's the most tender spot in your area is QRA. Okay. And that's one way. That's just one way. I've got many ways, many ways. So there's not one point. And that's why in our clinic, if somebody came for hypertension, I would go try this area first. And then if this didn't work, I would do another area. I could use my other arm, or I could use my leg. I use my leg, or I can use the ear. I can use the head. There's so many different ways, and we call these microsystems. So microsystems, there basically are parts of your body that reflect the whole body, right? So my ear reflects my whole body. My finger can reflect my whole body. So if I were to want to treat the heart with my finger, I know it's about the mid upper chest section. So I don't have a pen here. So I would just go to this area right here, right? This area right here. And I could do QRA, quick restorative acupressure, by pushing, right? I would need to see my thumb, it's hard to get into a really tiny point. You almost need a pen. Let me use this. Let me use this. This is not a pen, but I'm gonna use the side of this, right? And I would just push so I can get just a little point, right? And I would push to see, okay, where is it the most tender? And then wherever I find it's the most tender, that's where I would dig in. And I would dig in, right? And again, you have high blood pressure, right? So it's easy to test this is measure blood pressure. So you measure blood pressure before, okay? Measure your blood pressure before you do this, and then find the most sensitive spot, and then you would press on it for 10 seconds, right? Measure your blood pressure again. Your blood pressure should start to go down. Not drastically, but it will go down. And if it does go down, guess what? You got the right point. So then you would continue to press on that area, find that area, right? So you've got all these fingers, right? All these fingers you can do to treat hypertension. So there's like a million ways. That's my point. Okay. For those of y'all who are tuning in, I was just talking about hypertension or high blood pressure. If you have an ailment, so purpose of QRA, type into the chat what you are struggling with. Any chronic health conditions that you're struggling with, you need help with. If you want me to show you a QRA, I can. If you just want to help through the process, a lot of times people join in because they need help with a process of, oh, I have this disorder. I was diagnosed with this. I went to the physician. They did all this blood work. Either they didn't find anything wrong. They told me go home and just wait, come back in 6 months, or they told me, hey, you need additional testing, or try this, take this medication. But you take the medication, it doesn't work, or it works a little, your problem doesn't go away, or you're dependent upon that medication. For example, hypertension, high blood pressure. You know, the FDA says, and the Medical Association says, the gold standard of treatment for hypertension is to use blood pressure medications. And the FDA says that alternative or complementary therapies like Chinese medicine can never use the word cure. But in Western medicine, they can say they cure, right? But when you take blood pressure medications, you take it and you stop taking it, does your blood pressure go back to normal? No, it doesn't. So medications don't cure anything and don't cure any disease as well, right? Based on their own definition. So um, if you're into these situations, then you're like, what do I do? I don't want to be taking pills for breakfast, right? This is the channel. Type into the chat. Okay, we've got one veteran Ricardo. Eye floaters. Eye floaters are kind of like debris in your eye in this pool called the vitreous humor. Okay. Just a liquid in the back in your eyeball, and these debris, usually off your retina, they come and they float into your vision. If you have a lot, obviously you need to go see a optometrist first, and possibly an ophthalmologist. They have these cool back of the eye camera that they can take a picture of, right? It's not invasive. They just take a picture of the back of your eye, and they can just to see if you have a retinal tear. If you have a retinal tear, that is pretty emergency. You need to see an ophthalmologist. Okay. But let's say you've already gone through all that and they don't see a tear, right? And they just say, oh, it's just aging. All right. Then that's when people can come to our clinic and see my team. That's when you go find a Chinese medicine practitioner. Okay. If you have a retinal tear, you definitely need to go through an ophthalmologist. Okay. You need more intensive, invasive treatments. But let's say you have floaters coming in and out, right? So then you have to look at why. Why do you have floaters? And which are the organs in your body that control the processing of the debris that's in the back of your it's not really in the back of your eye. It's in your eye, okay? In the back compartment of your eye. Right? I think that's a better terminology. So you have to look at what the organs are, right? So if you have debris in your vitreous humor in the pool in the back compartment of your eye, those debris are supposed to be absorbed naturally absorbed, right? They're not supposed to be free flowing in the back compartment. So if normally what happens is your body absorbs them. Why is your body not absorbing them now? There could be a circulation problem, right? So let me show you, Ricardo, first. Circulation is where QRA comes in, right? QRA is phenomenal for circulation because QRA works, or quick restorative acupuncture. Obviously, you don't do by yourself. You need to find, actually, there's no clinic in the world that does QRA except my clinic, because I'm the one who created it. And I've only trained my team of providers to do it. No one else in the world knows how to do it. So I'm going to show you QRA acupressure. Okay. So look at this. Look at your finger, right? What does it look like? It looks like an eyeball, right? You got, look, 4 eyeballs right here, right? Eyeballs. God made our bodies perfectly. So if this looks like an eyeball, guess what? This area of the body, if you stimulate the nerves here, can stimulate the nerves and the blood circulation to your eyeballs. How cool is that, right? So what you're going to do, find like a ballpoint pen. I don't have one with me, so I'm using the edge of my cell phone charger, right? I'm just using the edge of it because it's kind of pointy. And I'm going to push on this area to find a most tender spot. Okay, right in that eyeball area. I'm pushing, go all the way around, right? But because the eyeball is soft, remember, if the problem area is soft, you want to find a soft area in your body. If the problem area is hard, like a bone, then you want to find a bone. Like, see, my knuckle is a bone, so I would not necessarily use that for my eye. I would go to the side of my finger, which is, this is all mushy, gushy, soft, right? And press. And guess what? If you can't find a sensitive point in your sensitive spot in your index finger, you got five more, okay? Actually 10 to try out, right? So you would go through every single finger and press on it. And these, you can try these. These look a little like eyeballs too, right? You can try these. So you got one, two, and maybe even three just for every finger. But I tried the middle ones first because the middle ones look more like an eyeball, right? So go through this and press on it. Now, the floaters aren't going to magically get absorbed instantly, okay? They just move around, right? That's why sometimes they're in your field, sometimes they're away from your field. But by stimulating these every night before you go to bed, I would do it as many times as possible throughout the day. When you're waiting at a bus stop, you're waiting for something, waiting for to go order, or or you're just sitting in your car, just push on it, right? Just push on these eyeballs, and that will stimulate blood circulation to your eyes to help your body absorb. More circulation to your eyeballs will help your eyeballs absorb that debris and those floaters. Okay, so that's I would say a branch solution, not I would say a branch option. So in every disease, we have the root and then we have the branch. The root is the root cause. The branches are the symptoms. Okay, the symptoms, like the eye floaters, they're just of the branch. So there's QRA for this specific situation can only address the branch, right? Now, if you want to treat the root of eye floaters, you have to look at what is the the main organs, because it's your organs that control the function of your eyeballs absorbing the eye floaters. So which organs are there, right? There's two main organs. One is your liver, one is your kidney. I would start with the liver, right? You can get actually, you can do a comprehensive metabolic panel. That specific set of blood tests, will tell you some basic, they don't show you everything, but they will show you some of the functions for the liver and the kidney, right? So you can start there. Or while you're waiting to get blood tests, right? You start from there and then see what other blood tests you need to do for your liver and your kidneys. You start there, and then while you're waiting, what can you do, right? To help your liver and your kidney. The liver, right? I've shared this last week. The foods that you can eat, cruciferous vegetables, specifically benefit your liver. So while you're waiting to go to an optometrist or ophthalmologist, while you're waiting, okay, to get some blood tests, I would start eating some cruciferous vegetables to nourish your liver, so your liver starts controlling your eyeballs again, right? And then at the same time, I would focus on that first. And then at the same time, I would focus on your kidneys. Let's help your kidneys, okay? Well, what foods can you eat for the kidneys? Kidney is a water organ, right? It's a water metabolism. That's why it's called water organ. They knew this 3,000 years ago, okay? Before they knew they could dissect the body. They knew the kidney before they had a microscope. Before the blood test. They knew all of this 3,000 years ago. I mean, that's just amazing, right? Don't you think that's amazing? And so the kidney is a water organ. So guess what? You eat foods with lots of water will help your kidney. How cool is that? God made our body so simple, right? We are just complicated. We need this vitamin. We need this mineral. I mean, we do need those, but they're all in food. We don't need to make them into synthetic food. That's the problem with supplements these days. And I love supplements, but too many natural practitioners are using supplements to replace medications. So medications you have pills, you have 20 pills for breakfast. But now the difference is there, the pharmaceutical companies are smart. They see natural practitioners in the public, they want a different type of pill, but it's still a palm full of pills for breakfast. It's called supplements now, right? And again, I love supplements. My team prescribes supplements, but not as breakfast, not just, all this for breakfast and for the rest of your life. If you have to take the supplement for the rest of your life, that's no different from taking medication. I mean, there is a difference. The supplements have less side effects. They do have side effects. They have less compared to medication. Okay. So, Ricardo, hopefully that helps. I gave you the branch treatment and I gave you the root treatment through food. Okay. Now, if you were to come to our team, to our clinic, obviously we would use QRA acupuncture. We would use Chinese herbs that would speed it up quickly, right? Depending on how many eye floaters you have, that would depend on the speed, right? And also your organ function. Can everybody with eye floaters be treated successfully 100%? No. No. Okay. If you have a retinal detachment, no. You need to go to an ophthalmologist. Okay. If it's just episodic, sporadic eye floaters, yes. Okay. All right, last one. Faith, hope, love. Thank you. What do you do to normalize low blood pressure? Low blood pressure, first your retina are good. Okay, perfect, good. Low blood pressure. So again, let's look at some root and branch. Okay, root, remember, you have the root, and then from the tree root, you have the branches, right? The branches are the symptoms. The roots are the root cause or the trunk. That's how I like to say it, okay? So low blood pressure is a branch. All symptoms are a branch. Let me repeat that. If you have a root and then you have the branches, root cause, branches, symptoms. All symptoms are branches. Anybody who focuses only on the symptoms are only treating the branches. What does that mean? That means they're not focusing on the root. What does that mean? That means you may get results from them. You may not have the symptoms anymore, but eventually your symptoms will all come back because they didn't treat the root. Okay. So if you want to fix your problem, or as the medical association, cure your problem, you have to fix the root. And who can cure the root? Nobody can. If any physician, even any acupuncturist says, oh, I can cure you. No, your body is the only person that can cure you. What we do is just assist your body to cure itself. I don't cure anybody. My team doesn't cure anybody. We assist your body to do it. Western medicine doesn't assist your body to do it. Western medicine says, let me do it. Let me try to do it for you. But they can't, right? So with high blood pressure, I've already shared that. Low blood pressure, right? There could be some nutrient deficiency. So you need to get some blood tests. What are the three and then the branch, right? I'll start with the branch. The branch is low blood pressure. You could be electrolyte imbalance. If you have electrolyte imbalance, then you will have low blood pressure, right? If you are, my dad actually was recently in the hospital for other reasons, but they were pumping him full of, he was in for a liver problem, but they were pumping him full of IV saline and albumin, which is a protein in the blood, and they dropped his blood pressure to life-threatening situation. So he didn't have a low blood pressure problem, but because the physicians were giving him, antibiotics, medications for other things, they caused him to have hypotension. His blood pressure dropped to 60/40, life-threatening situation, right? And so if you have that, his was artificially induced. So it was an electrolyte balance. And then once they stopped the medication, pumped him with other electrolytes, then his blood pressure went back up. Now, if you have a chronic low blood pressure, that is a different issue. But it could still be a chronic electrolyte imbalance. You need to go get some blood tests. Go get a comprehensive metabolic panel and the basics, the CBC, and see if you are having electrolyte deficiency. Usually it's a deficiency, right? You don't have enough salt, potassium, because where salt is, water goes. So to raise blood pressure, this is what the emergency did. They pumped my dad full of salt, right? Salt and albumin, because when the salt is in your blood vessel, or albumin is in your blood vessel. Water, they soak up water. So they cause the water from the interstitial, from all the other places outside of the blood vessel to go in to inside the blood vessel. So that increase the volume of blood. And so let's say your pipe is like this, right? Your blood vessel is like this. And so if you increase the volume, amount of water that goes through here, then it's going to increase your blood pressure, right? So that's one way, potential cause of low blood pressure, right? Is electrolyte imbalance. You could have a nervous system problem, right? Where your brain is just not communicating effectively. It's not communicating effectively with your circulatory system, like your heart, your lungs, right? It's not communicating effectively. So that could be an issue, right? But let me address, I just got a few more minutes. So let me just address the root cause. Okay. The root cause is organ dysfunction. So what are the roots of low blood pressure? Liver, kidney, and heart. Do all your organs affect blood pressure? Absolutely. But these three main organs, liver, kidney, and heart. Okay, so similar to what I shared with Ricardo, you can start eating those foods for your liver. Cruciferous vegetables for your liver, water foods, cantaloupes, honeydews, melons, watermelon, peaches, plums, right? Grapes, all have tons of water. For your kidneys, heart, right? Heart. So heart is correlated to obviously blood, red foods. Okay. Now it's not necessarily a red food, but cherries. Cherries are red. You know, some cherries are red. Cherries can benefit your heart. So foods that are naturally red. I'm trying to think of other foods that are naturally red, but that would benefit your heart, right? Um, so those would start helping those your organ systems perform better, which will help regulate your blood pressure, right? So that is what you could do at home, right? Now, before you start just chugging down salt, I would do a blood test first. Make sure that you are salt deficient or, potassium deficient. Make sure before you just start chugging, right? You could drink some electrolytes, for example, coconut water. That will give you some electrolytes naturally. Don't go pound the Gatorade, right? Gatorade has, yeah, beets. Beets are good too for the heart. Don't go pound Gatorade because they have a lot of sugar, right? And they have so much sodium. It's not a balanced. So I would do coconut water is the most natural electrolyte. Pickle juice could be another one, but I would go for coconut. Pickle juice is still it's processed, somewhat processed because you're adding stuff to it to make the pickle juice. So I would go with coconut water for electrolyte balance and try that for a few days and see if your blood pressure starts to normalize back to normal. Okay. So those are the things I would do at home. Again, go get blood tests. You need to find out what is the root cause. Okay. So what we would do in our what my team would do in our clinic, obviously we would treat the communication problem. That's what QRA is best for. QRA can reestablish the communication from your central nervous system back to the rest of your body, your peripheral nervous system. So your autonomic nervous system. So your blood pressure is automatically regulated by it's called your autonomic nervous system. Autonomic means it happens without you even thinking, right? And so if that is out of whack, so to speak, then of course your blood pressure won't be controlled. So the QRA, my QRA can reestablish that connection. So that would address that connection. Okay, QRA. The second thing we would do is we make sure which organs are dysfunctioning, and we would use Chinese herbs. And I have created my proprietary formulas that can be customized for everybody's body. And we would use that to more quickly normalize your blood pressure. At the same time, we would help you with your nutrition and lifestyle habits, which would help you develop a habit so that you can maintain. See, in our clinic, what we do is we focus on treating the root cause, which will fix the problem. What does that actually mean? When we fix the problem, if we can fix it, we can't fix everybody, but if we fix your blood pressure, your low blood pressure problem through, my QRA, my functional pulse diagnosis herbs, nutrition, some supplements, and dietary lifestyle modifications. After we help you get your blood pressure normalized, then what we do is we start removing each therapy one by one, not all at the same time. We don't want to shock your body, but we remove it one by one. What's the purpose of that? That is to allow your body to take over. So majority of our patients, when they come to our clinic, we help them using our tools. We help them get to the goal that they want. Once they reach the goal, we start removing us. We remove the herbs, the QRA, right? So you're left with the information, the knowledge that we helped and recommended for you, lifestyle modifications, dietary modifications. You are left with that, and you can maintain it by yourself without us. That is our definition of fix. I don't know what other people do, but this is what we do. And that's why we're the #1 rated acupuncture and wellness clinic in the entire US. All right, guys, thank you for joining in. Make sure, hey, I know a lot of people joined in later, and I thank you, but time is up for me, so I need to leave, get ready to go. I start my day. So it's 4 p.m. Central Standard Time. Make sure you show up on time so I can go through the same process with whatever you're struggling with. 4 p.m. Sundays, Central Standard Time, or 6 a.m. Taiwan time, okay, on Monday. 6 a.m. Taiwan time on Monday. So it's Sundays. I'll just say Sundays. Sundays, 4 p.m. Central Standard Time. All right. Thank you for joining. Peace.